Welcome to our channel. I am Diana, your guide through the fascinating world of psychology. Today we embark on a journey into the complex landscape of mental health, focusing on a condition that is often misunderstood, yet profoundly impactful. Dissociative Identity Disorder, or DID. This disorder is characterized by the presence of two or more distinct personality states, leading to significant disruptions in a person's life. It is a testament to the immense resilience of the human mind, but also the profound effect of trauma. Our understanding of mental health disorders is crucial, not only for those who study psychology, but also for fostering empathy and compassion in our society. In this video, we will delve deeper into the understanding of dissociative identity disorder, its diagnosis and implications. Dissociative identity disorder, often abbreviated as DID, is a complex psychological condition. At its core, DID is characterized by two or more distinct identities or personality states, each with its own relatively enduring pattern of perceiving, relating to, and thinking about the environment and oneself. Each individual identity is unique, having its own name, personal history, characteristics, mannerisms, and even different physiological responses. These alternate identities, often referred to as alters, alternately take control of the person's behavior, causing significant disruptions in memory, perception, and identity. This is not a case of simple mood swings or different aspects of one's personality coming forward in different situations. Rather, these are distinct identities that can have different ages, genders, and even nationalities. Some people with DID may have just a couple of alters, while others may have dozens. One of the most striking aspects of DID is dissociative amnesia. This refers to the inability to recall important personal information that is too extensive to be explained by ordinary forgetfulness. For instance, a person might not remember certain time periods, events, people, or personal information. The impact of DID on a person's life can be profound. It can cause significant distress, impair social and occupational functioning, and can lead to a host of other mental health issues like depression, anxiety, and post-traumatic stress disorder. What's important to remember is that DID is not a choice. It's a survival mechanism, often developed in response to severe trauma, particularly during early childhood. The mind, in an attempt to protect itself, creates these separate identities to compartmentalize the traumatic experiences. DID is a fascinating yet misunderstood disorder, making its diagnosis a challenge. Understanding the intricacies of this disorder is not just important for those affected, but also for those around them. By fostering understanding, we can break down the stigma associated with DID and bring about more effective treatments and support for those living with this condition. The exact causes of dissociative identity disorder, or DID, are still not entirely understood, but it is believed to be a response to severe trauma. This isn't your average everyday stress or trauma, but rather it's often extreme, recurrent, and invasive, typically occurring during a crucial developmental stage in early childhood. Imagine a child's mind, like soft clay, being molded and shaped by their experiences. Now, consider what would happen if that child was subjected to intense, persistent trauma or abuse. The child's brain, in its desperate bid for survival, may resort to a fascinating yet complex defense mechanism. This involves compartmentalizing the traumatic experiences, pushing them into separate corners of the mind, effectively creating multiple identities or alters to cope with the distress. This is the core concept behind DID. But it's not just trauma that plays a role. Neglect, especially emotional neglect, can also contribute to the onset of DID. A child who is consistently ignored, belittled, or made to feel worthless may also employ dissociation as a coping mechanism, creating alters that embody the love, care, or attention they crave but are denied. Additionally, the brain's inherent resilience and adaptability play a key role. In some individuals, the brain's ability to adapt to such intense trauma leads to the creation of these alters, each carrying a fragment of the traumatic experience. This is the brain's way of protecting the individual from the full force of the trauma. It's important to note that not everyone who experiences trauma or neglect develops DID. It's a combination of factors, including the severity and duration of the trauma, the individual's inherent resilience and coping mechanisms, and their social and emotional support system. Though the causes are complex and multifaceted, early detection and diagnosis can lead to effective management of the disorder. Remember, understanding is the first step to acceptance, and only with acceptance can there be recovery. Diagnosing DID is a complex process that requires careful observation and understanding. It's not as simple as ticking off a checklist of symptoms. Instead, it's a nuanced process that delves deep into a person's experiences, emotions, and behavior patterns. The first step in the diagnostic process often involves an extensive psychiatric evaluation. This is not a quick chat, but a comprehensive conversation that explores the individual's life history, thought patterns, emotions, and behaviors. The clinician is looking to understand the person's inner world, their experiences of self and others, and how they navigate their day-to-day life. A key part of the evaluation is assessing symptoms. To be diagnosed with DID, a person must exhibit two or more distinct identities or personality states, each with its own perception of the environment and self. These identities recurrently take control of the person's behavior, leading to notable disruptions in their life. Additionally, the person must have recurrent gaps in the recall of everyday events, personal information, or traumatic events that are too extensive to be attributed to ordinary forgetfulness. But symptom criteria alone are not enough. It's also important to rule out other potential conditions. This is where things can get tricky, as DID symptoms can overlap with those of other disorders like schizophrenia, bipolar disorder, or even severe depression. It's crucial to distinguish between these conditions to ensure an accurate diagnosis. For instance, while both DID and schizophrenia involve hearing voices, in DID these voices come from within and represent different identities, while in schizophrenia, the voices are perceived as coming from external sources. Moreover, it's essential to consider physical conditions that may mimic psychological symptoms. Sometimes conditions like epilepsy or certain types of brain injury can cause experiences that seem similar to DID. Therefore, a thorough medical evaluation is often part of the diagnostic process to rule out these possibilities. Then there are thorough clinical assessments. These involve structured interviews and symptom rating scales that are specifically designed to identify and measure dissociative symptoms. These assessments provide a more objective way to determine the presence and severity of symptoms, supporting the information gathered during the psychiatric evaluation. Diagnosing DID is not a race, but a journey. It requires patience, empathy, and a deep understanding of the human mind. It's not about labeling someone, but about understanding their experiences and finding the best way to help them navigate their world. The diagnosis is a crucial step, setting the path for appropriate treatment and management strategies. It's the beacon that guides the therapeutic process, illuminating the way towards healing and integration. It's the starting point that allows individuals with DID to understand their experiences, validate their emotions, and begin the journey towards a healthier, more integrated self. Despite its prevalence, dissociative identity disorder, or DD, is often misunderstood, leading to a host of misconceptions. Let's address some of these common myths and compare them to the reality. A persistent myth is that people with DID are violent or dangerous, largely fueled by Hollywood portrayals of the disorder. In films, characters with DID are often depicted as unpredictable villains with malevolent alternate identities. However, this is a gross misrepresentation. People with DID are no more likely to be violent than anyone else. In fact, they're more likely to harm themselves than others. Another common misconception is that DID is a rare condition. While it's true that it is not as common as, say, anxiety or depression, DID is not rare. It's estimated that 1 to 3% of the global population could be living with the disorder. That's as many as 225 million people worldwide. Yet another myth is that DID is the result of an overactive imagination or attention-seeking behavior. This is not the case. DID is a serious and complex mental health condition, often linked to severe trauma experienced during early childhood. It's not something that someone can just make up or snap out of. Finally, there's the misconception that people with DID have a visibly obvious switch between identities. In reality, switches can be subtle and may not be immediately noticeable. Each identity serves a purpose and helps the person cope with different situations or emotions. These misconceptions can create a stigma around DD, causing those affected to feel misunderstood or judged. It's important to remember that mental health conditions, including DDD, are not choices. They are not something to be ashamed of, and they certainly do not define a person's worth or potential. Understanding DID beyond the misconceptions is essential to destigmatizing the disorder and supporting those affected. As we continue to learn and share accurate information about DID, we can foster empathy, acceptance, and better support for those living with the disorder. Living with DID can be challenging, but it's not an insurmountable obstacle. Imagine waking up and not knowing where you are or even who you are. That's a reality for some living with dissociative identity disorder, or DID. Each day can bring its own set of challenges, and the unpredictability of it all can be quite daunting. But remember, it's not an impossible mountain to climb. A person living with DID experiences a life quite unlike the norm. They may host multiple identities, each with its own distinct set of memories, behaviors, and even physical attributes. This can lead to periods of lost time, where they can't recall what they've done, as if they've been on autopilot. It's like living several lives in one body, but the challenges don't stop there. The societal stigma surrounding DID can be a significant hurdle. Misunderstandings and misconceptions about the disorder can lead to isolation and fear. It might make individuals feel like they're in a constant battle, not just with their own minds, but with the world around them. Yet people with DID are not defined by their disorder. They're individuals who learn to navigate life in their own unique way. They're survivors who have found ways to cope with their condition. One crucial component of coping with DID is having a strong support network of understanding friends, family, and mental health professionals. This network can provide a safe space for individuals with DID to express their feelings and experiences without fear of judgment. Therapy too plays a crucial role. Techniques like cognitive behavioral therapy, dialectical behavior therapy, and eye movement desensitization and reprocessing can help individuals manage their symptoms and improve their quality of life. Living with DID is not a life sentence of suffering. It's a journey that, while fraught with challenges, can also be filled with growth, resilience, and triumphs. It requires understanding, patience, and most importantly, empathy from those around them. With the right support and understanding, individuals with DID can lead fulfilling lives. Understanding DID is not just about learning the facts, but also about empathizing with those living with the disorder. Let's take a moment to reflect on what we've learned today. We started by defining dissociative identity disorder, or DID. It's a complex psychological condition that's marked by two or more distinct identities or personality states. It's not a character flaw or a sign of weakness. It's a disorder that results from severe trauma, often in early childhood. Then, we delved into the causes of DID. It's not something that people choose or bring upon themselves. Rather, it's a survival mechanism, a response to overwhelming trauma. In an attempt to cope, the mind may create separate identities, each with its own way of interacting with the world. We also discussed the process of diagnosing DID, which can be quite complex. It's not a straightforward process, as it involves ruling out other mental health conditions and taking a detailed history of the person's experiences. It's critical that this process is handled by a professional who is knowledgeable and experienced in the field of dissociative disorders. Perhaps one of the most crucial parts of our discussion was dispelling some of the common misconceptions about DID. It's not a rare exotic disorder reserved for the silver screen. It's not about being crazy or dangerous. People with DID are just like anyone else. They're individuals who have experienced profound trauma and found a unique way to cope. We also touched on what it's like to live with DID. It's not easy, and it's often misunderstood, but it's not a life sentence of misery. With the right support, people with DID can lead fulfilling and meaningful lives. They're not defined by their disorder, but by their strength, resilience, and humanity. As we come to the end of our exploration, it's important to remember that if you or someone you know may be experiencing symptoms of DID, reaching out to a mental health professional is the best course of action. Self-diagnosis can be harmful and inaccurate, and it's crucial to seek help from someone who is qualified to provide it. Dissociative identity disorder is a complex condition, but it's one that we can begin to understand with empathy, compassion, and knowledge. It's not about sensationalism or stigma, but about recognizing the strength and resilience of those living with the disorder. So, as we finish our journey today, let's take with us not only a deeper understanding of DID, but also a newfound respect for those who live with it every day. Let's challenge the misconceptions, question the stereotypes, and strive to create a world that's more understanding and accepting of all mental health conditions. Remember, understanding starts with us. Thank you for joining me, Diana, on this exploration of dissociative identity disorder. Until next time, stay curious and compassionate.